To me, I'm Dr. Sunita Rana Agarwal and Bhuvna. We are going to make a presentation together. So I'm going to talk to you on the visuals and she's going to talk to you on the presentation. But some of the visuals that you're going to see have not ever been put up on a scientific platform. Why? Because nobody has the formulation called morphogenetic activator of nucleic acids. This is a formulation which acts as a catalyst. So it comes in touch with your blood. It will make your fetal cells and fetal DNA. So we're talking fetal stem cells, we're talking fetal cells. That picture that you're seeing right now is the first second when the DNA is getting formed. This is a very, very high-end microscope that takes 125 shots per second. And then we've played it out so that you can actually see the ribbons of the DNA getting layered down. We have reconfirmed it with fluorescent staining so that you know that, yes, this is DNA. This is the fluorescent staining. Along with this, we have now got over 20 years of research that has been done with humans. So we are talking first, there was another 15 years of research which was on animals. Then 2004, we started working with humans. And when we started seeing all worst case scenarios like cancer, congenital diseases, blindness, these kind of diseases were getting treated to some order. This sent us onto a very big spur. And we took this whole presentation in 2006 to, at that time, our President Abdul Kalam. He didn't want to take it in the government of India because he said there's too much red tapeism, but I should take it to the DRDO, and he called in the DRDO. My appointment and meeting with him was only 5 minutes, but it went on for more than an hour and a half. You're seeing now, that is the layer down of actual DNA. Once again, those labs exist only with the DRDO, but the formulation only exists with us. So here what we do now is we pick up the DNA with a 5-micron cannula. So that, what you're seeing is 5 microns. We've picked up the DNA, we're going right into the optic nerve of patients who are completely blind. This helped us to understand that we can actually make some amount of dead nerves come alive if they should get back their fetal DNA. What you also would like, this looks like the galaxies, but it's all DNA which has got fluorescent tagging on it. This is how big the DNA can become. If we just left that storage inside the refrigerator, took it back, it would be 200, 300 microns big, the DNA particle, as you just saw. And this is the DNA, once again, with fluorescent and white light. So you can make out there are so many other particles, but the particle, which is DNA, gets fluorescent. All this made us understand that this was too powerful a mechanism in our hands, and that's why we wanted to give it to the government of India. That's where we are still. However, as you met Dr. Rajshekhar, our CDSCO in the morning, he has already given us the license to continue with all this. There is a really very, very big learning curve where regulatory affairs are concerned. And what Dr. Lalit Kishore explained to us earlier is really very true. What we are trying to do here is help you learn that learning curve much faster. Now we are going right into the optic nerve of the blind patient. And what this patient told me on table was, as soon as I put in the DNA, he said, I can see the operating light microscope. There was no perception of light, but once we injected it onto the optic nerve, he could see light. These are small, small things which over the 20 years, we have done over 18,000 patients. We have learned as we go that one injection is not suffice. We need to give that patient 10 injections. 10 injections every day, so we are able to slowly take out the DNA mutations. What we have also seen, these are all retinal detachment cases, which we first operate and then we go back and put this in. What we have also seen is, in these 18,000 patients, giving them 10 injections a day, our mechanism has got very, very, very finished. So we just take 1 drop of blood from the patient's finger. We need to get their random blood sugar. The random blood sugar, why? Because what you're giving this patient back is his fetal DNA. It's his fetal stem cells. What does a baby want? He wants to sleep and he wants to eat. So we need to make sure that the blood sugar of the patient is over 100. These are 2 very important points for us, which we have understood over time. 1, get all the vital statistics, get the blood pressure, etc., and the sugar. If the sugar is below 100, we will not give the injection, because every injection is going to drop the blood sugar by 40 counts. So if it's sitting at 80, it's going to 40. 40, the patient is going to fall unconscious, or Ram Naam Satya hai. So we don't want to do all that. And so far, in these 18,000 patients, we do not have even 1 complication.